Dr. Rena Malik, a board-certified urologist and expert on sexual health, is on a mission to educate the public on the facts and myths surrounding sex. In this podcast episode, she delves into various aspects of sexual health, debunking myths and providing valuable insights. Dr. Malik defines sexual health as the ability to have sex, experience pleasure, and achieve orgasm. She emphasizes the importance of normalizing discussions around sexual health as it plays a crucial role in overall well-being. However, she notes that there is a lack of understanding and education in this area, leading to misconceptions and shame. As an expert in the pelvic floor, Dr. Malik highlights the significance of this group of muscles in sexual function. The pelvic floor is involved in orgasm, sexual function, and stability, yet it is often overlooked in discussions about sexual health. Issues with the pelvic floor, such as weakness or tension, can lead to a range of problems, including erectile dysfunction and pain during sex. One prevalent myth Dr. Malik addresses is the belief that other couples are having more sex than we are. She explains that studies show people in partnered relationships have sex about once a week on average, emphasizing that quality is more important than quantity. She also debunks the myth that sex is supposed to hurt, highlighting the importance of arousal, lubrication, and communication in preventing pain during sex. Dr. Malik stresses the importance of open communication about sex within relationships. She acknowledges that discussing sexual issues can be challenging due to societal taboos and personal insecurities. However, she encourages couples to have honest conversations outside the bedroom, focusing on their needs, desires, and concerns. Seeking help from a sex therapist or counselor can also be beneficial in navigating these discussions. For couples who have reached a point of stagnation in their sex life, Dr. Malik suggests reflecting on the importance of sex in the relationship. If sex is a priority and issues persist, she recommends taking proactive steps to address them. This may involve seeking professional help, exploring new techniques, and prioritizing open communication to reignite intimacy and connection. Desire comes in two forms: spontaneous and responsive. Spontaneous desire occurs when you are immediately turned on by someone, while responsive desire is triggered by intimacy and connection. It is common for women to experience responsive desire, especially in long-term relationships. By recognizing and accepting these differences in desire, you can approach intimacy with a more open and understanding mindset. Various factors can impact libido and hormone levels, including stress, sleep, and exercise. Chronic stress can lower testosterone levels, leading to a decrease in libido. Adequate sleep and regular exercise, particularly resistance training, can help maintain healthy hormone levels. Additionally, a balanced diet rich in fruits, vegetables, and healthy fats can support overall hormonal health. Studies have shown a significant decline in testosterone levels over the past few decades, which can have implications for fertility and overall health. Environmental factors, such as exposure to endocrine-disrupting chemicals, may contribute to this decline. By reducing exposure to these chemicals and adopting a healthy lifestyle, individuals can support their hormone levels and overall well-being. Fertility issues are a growing concern, with many individuals experiencing challenges when trying to conceive. Both male and female factors can contribute to fertility problems, highlighting the importance of seeking medical evaluation and support. Lifestyle factors, such as diet, exercise, and stress management, can play a role in fertility outcomes. There is a correlation between overall health and sperm quality, particularly sperm concentration. Factors such as hydration, ejaculation frequency, and pelvic floor strength can influence semen volume and quality. Maintaining a healthy lifestyle, including regular exercise and a balanced diet, can support optimal sperm production and fertility. Dr. Malik discusses the potential impact of devices such as phones and laptops on sperm production. She explains that these devices can increase the temperature around the scrotum, which can disrupt the ideal environment needed for sperm production. For example, placing a phone in the back pocket or near the genitals can lead to an increase in temperature, potentially affecting sperm count. Dr. Malik advises against placing devices directly on the lap or near the genitals to avoid any potential disruptions in sperm production. She also addresses the common misconception that masturbation can decrease testosterone levels. She explains that there is no empirical evidence to support this claim. While there was a study that showed a slight increase in testosterone levels after abstaining from masturbation for 21 days, the overall impact on testosterone levels is minimal. Dr. Malik emphasizes that masturbation is generally safe and does not have a significant impact on testosterone levels. She advises against white-knuckling, abstaining from masturbation solely for the purpose of increasing testosterone levels. Dr. Malik discusses the potential effects of excessive masturbation on health. She explains that while masturbation is generally safe, it can become problematic if it interferes with daily activities or becomes a compulsive behavior. She highlights the importance of varying masturbation techniques to prevent habituation and ensure healthy sexual function. She also addresses the concept of post-nut clarity, where individuals may experience a decrease in desire after ejaculation, noting that this phenomenon is common among men. Dr. Malik explores the relationship between masturbation and prostate cancer. She references a study that found a potential correlation between higher ejaculation frequency and a reduced risk of prostate cancer. While the exact mechanism is not fully understood, she suggests that regular ejaculation may help maintain prostate health by flushing out stagnant fluids. She emphasizes that masturbation is a normal and healthy activity that may have potential benefits for prostate health. Dr. Malik addresses the topic of pornography and acknowledges that while pornography is a form of entertainment, there are concerns related to its accessibility and potential addictive nature. She highlights the issue of children being exposed to pornography at a young age and the implications this may have on their understanding of sex and relationships. Dr. Malik reflects on the potential implications of advancing technology, such as virtual reality, on pornography consumption. She raises concerns about the increasing realism of virtual experiences and the potential impact on real-life intimate relationships. She acknowledges the possibility of technology influencing individuals' preferences and behaviors, but she also emphasizes the importance of physical touch and intimacy in human relationships. She hopes that despite technological advancements, people will continue to value and seek out genuine connections with others. Dr. Malik emphasizes the significant role that trauma can play in sexual health and dysfunction. Trauma, whether physical or emotional, can have long-lasting effects on an individual's sexual well-being. Seeking therapy and support to address unresolved trauma is crucial in improving sexual health outcomes. Dr. Malik provides insights into the anatomy of the clitoris and its role in achieving orgasm. She explains that clitoral stimulation is a key factor in female orgasm and highlights the importance of communication and understanding individual preferences in sexual encounters. Orgasm is described as a complex physiological response involving tension, release, and intense pleasure. Dr. Malik discusses strategies for enhancing female pleasure and sexual satisfaction, including the use of lubricants, scheduling time for intimacy, and focusing on quality rather than duration of sexual encounters. Mindfulness and communication play crucial roles in creating fulfilling sexual experiences. Dr. Malik debunks the myth that a woman's vaginal size increases with sexual activity. She explains that vaginal size is not determined by the frequency of sex, but can be influenced by factors such as childbirth, pelvic floor strength, and age. Pelvic floor exercises, including Kegel exercises, can help strengthen the pelvic floor and improve sexual health outcomes. Dr. Malik emphasizes the importance of pelvic floor exercises for both men and women. She explains that these exercises involve engaging the same muscles used when stopping a urine stream, lifting the penis off the ground without touching it, or holding in a fart. By squeezing and relaxing these muscles, individuals can strengthen their pelvic floor. She recommends starting with exercises while lying down and gradually progressing to sitting or standing positions. She also highlights the role of pelvic floor physical therapists in assessing and treating pelvic floor issues. Pelvic floor issues can manifest in various symptoms, such as urinary leakage, pelvic pain, prolapse, and sexual dysfunction. In men, weak pelvic floor muscles may lead to decreased force during ejaculation. Dr. Malik advises individuals experiencing pelvic floor symptoms to seek evaluation by a healthcare professional, such as a urologist or pelvic floor physical therapist. Through a rectal exam, the pelvic floor muscles can be assessed to determine the appropriate treatment plan. Dr. Malik addresses common concerns about penis size and offers insights into methods for increasing length. She explains that traction devices have been shown to be a safe and effective way to lengthen the penis over time. While pumps and surgeries are available, they may carry higher risks or complications. Dr. Malik also discusses the societal perceptions of penis size and emphasizes that sexual pleasure and satisfaction are not solely dependent on size. She encourages individuals to prioritize overall sexual health and well-being. The topic of female ejaculation and squirting is often misunderstood and misrepresented in popular culture. Dr. Malik clarifies that female ejaculate is a small amount of fluid produced by the Skene's glands, similar to male ejaculate. Squirting, on the other hand, involves the emission of a clear, colorless fluid from the urethra. Studies have shown that squirting may contain prostate-specific antigen and dilute urine, but the exact origin of the fluid remains debated. Dr. Malik underscores the need for further research and education on female sexual response to dispel myths and misconceptions. Labiaplasty, a surgical procedure to alter the size or shape of the labia minora, has seen a significant increase in popularity in recent years. Dr. Malik explains that while labiaplasty can address functional concerns or discomfort, it is also driven by societal beauty standards and misconceptions about genital appearance. She advocates for embracing the diversity of labial anatomy and promoting body positivity. She emphasizes that individuals should make informed decisions about cosmetic procedures and prioritize self-acceptance and self-care. In her work and advocacy, Dr. Malik conveys a powerful message that sexual health is an integral part of overall well-being. She stresses the importance of education, communication, and empowerment in promoting healthy attitudes towards sexuality. By addressing taboos, challenging stereotypes, and providing accurate information, Dr. Malik aims to create a more inclusive and supportive environment for sexual health discussions.